Good afternoon everyone. Today I am going to present a case of bowel incontinence. He is a child of 8 years old. So along the case I will say why I asked, the purpose of the question and what it will come. So how to pick the anchor, in what way I have opened up this case. While I am going, listen to that also, it will be great help. Every case is different and every technique won't be fixed to this. But we have to take from sir's experience and follow in our practice. We get some new techniques, then we understand what is that. We can't cut, copy, paste. So just listen the technique also, it will be useful for you. Okay. So first I asked to the mother. I kept the child and mother narrated. From birth he had Hirschsprung's disease. For 2 days the child didn't take the milk or didn't pass stool. So they done biopsy and colostomy and found there is no abnormality, then they closed. Then after 6 months again the problem, there is no intake, there is no and complete constipation. Next, so they found again biopsy, there is no ganglion cells in the rectum, so there is no control, no passage, no relaxation. That's why they done a pull through surgery. They cut the part and join with the anus, the colon which has nerve. That is the surgery done. After that also surgery, there is involuntary leakage of stool daily 3-4 times. So he is studying 3rd standard. Up to that, from 2 years to 3rd standard, he has the leakage of stool. In school also he feel very difficult. He couldn't sense that's coming. So that is the issue. So that there are eruptions around the anus because of the constant moisture. So also vomiting sensation, nausea, because of that some issue he couldn't let out. So after surgery also there is little bit of that effect is there with him. The child is near. I have observed him also. He is not interested in that talk because these much years he said she will say about her suffering in the hospital about the child. He hear that every time and he is not interested. He don't like to speak about that also. Next. So I said okay ma'am, you sit outside, I will talk with him. So before knowing this, generally before taking case I know the background. I will ask while calling. So she is the boy's father is the principal of the school, mother is a yoga teacher, both are my patients. After that son came. So I know that. Then the connection with both us also with this boy is not much. They don't know how is he. So I don't like to go in the area about family or parents to select what is his interest. So I know the principal issue, the patient he has shifted from one school principal to other school because of some issue in the case. So I know this boy has crossed 2 schools. Last year there is summer school, this year he went to under school. So I like to compare what you like because he is a child, it should be a casual talk. So I said, forget what your mom said, we no need to know that, my son is also his school. So I said, okay, tell about your school, which you studied before and now. Do you study in the same, first my question is, did you study in the same school from LKG? Because we have to be, we shouldn't say that I know, because they won't open up. That is the reason I said, did you study in this school from LKG? So he said, no, this is my 2nd school. That time his speech is stammering. So I asked for comparison, which school you like the most? Because there will be comparison, we can get what is his interest, what is his sensitivity area from 2 sides. It is an additional point, that is what. So I like 2nd school because there are many games, arts and cultural. Next. I know both school have the usual facilities. So I asked, why the first school don't have this? No, everything is there. But in first school the PT periods, the sir will ask 5 rounds to go. But in 2nd school there are only 2 rounds. So I don't like first school. What are the other issues? Sir will scold me and beat me if we didn't sit proper. So then there is so much of stammering. So I asked what you don't like exactly in that PT period. So my leg hurts more. So much energy and he is feeling the pain. And sir is also will scold, no, that fear will be there. Next. So I asked to compare. In this school, do you like everything or some other thing you don't like? So he said Hindi class I don't like because in this school from LKG they teach Hindi, in that he don't know. But so he can't fluently speak with the friends. So all will laugh at me. That time is also stammering. They are also stammering, here is also stammering. So I asked, how it this is casual talk, not probing, just a casual talk. So I asked, how you feel inside while you are laughing? I feel sad, my friend consoles me. So I asked the same question different way. What happens to you at the moment they laugh? I feel like beating them, but I won't do, or main thing is I won't complain, ma'am. My question is, he's the son of the principal, why don't he complain to ma'am, or even to his sir he didn't complain? So that is the thing is, okay, if normal child say okay, but he is the son of the principal, he can complain, he can say that they are laughing, they are beating me, but he didn't say. So feel like, then I asked why, because again they beat me more and hurt me more, that's why I won't open up. Next. So I asked, so this much is casual talk, half an hour it gone, mother also half an hour, so 1 hour. So I felt, okay, let's break, because something, scolding, beating, hurting, laughing, I got. Then I will give a break for sure in every case, whenever I collect something about them. And I gave a break because she is a child, maybe he like to see the mom or drink water or something. So be with the mom, take some snacks, I will talk for 1 more hour, so you shouldn't feel hungry, that is the, make the patient comfortable. If you need to go to restroom, maybe Skype case, go to restroom, fresh up yourself, take 10 minutes time, I'll go through your case and I will. So they feel also comfortable, they won't feel hungry or any urges will be satisfied. So their focus is also, that is the comfortable we have to make to the patient also. So I know something is sensitive in the school, so I asked the peculiar, tell me the incident in school which affects you the most in detail, how we are sad as dreams likewise. So he said, last week I also know there is a science experiment, something function is there. He done 2 experiments, one about density using in the test tube oil, water, chocolate something, and water purifier. The 2 experiments he have done, he described detail, and some friends have shook the test tube so that everything is mixed and he couldn't present that. So I cannot present it. They even laughed at me. So some detailed conversation he made that. So I asked, what affects you in the most in it? There also he said, all are laughing at me. That time stammering. Side by side we should have the peripheral vision also, the body language, the energy, where they go up and down, the voice. This is the side by side observation. So I said, okay, because he is child, okay dear, I understand, laughing hurts you, but how it feels to you at that second, the moment they laugh, the moment, how it feels. So I feel to beat them, but I won't do it. So again beating comes. That is the peripheral view. This is focus is laughing only, but peripheral beating is also common 2-3 times. So I asked, why you won't beat them? So he said with energy, immediately, because they will punch with force in my palm. It will pain a lot, you know. I get the gesture itself, I fear on seeing the punch, not punching. On seeing the punch, I get the fear. He said this, some friends prick the sharp of the pencil in here and they play. So on seeing the prick in the hand, in the hot skin, his body will shook in fear. So, okay, tell me the fear little bit more. When it pricks, when they play pricks, the nervous system will stop its function completely. What is this? The third standard boy saying nervous system will stop completely. So I asked next. Okay, so I asked, see already in that energy level, he is feeling that pain. He is going into, it's not a detailed, but he is talking about the system. He is in that action moment. So I asked, nervous system stops? Oh, I don't know about that. Can you please explain the process of that? So he said, oh, you don't know, ma'am. Okay, I will say. See, when it pricks the pencil, no message goes to the brain through the nerves, and we cannot think that time. We start to drink in a wrong way. If I have to drink water, I will take, but I will pour down. I will take a new paper, I will tear it. That is the stupor state. If you need to say the word, that is stupor state. Doing everything wrongly. Then heart stops immediately. And and after that every organ stops it functioning gradually, and at one time faint and coma state will be there. Next. So the heart stops immediately with very gesture. No, this much, the heart stops immediately. So I like to know what are other areas the same thing comes with energy. So I asked, heart stops immediately, any other incidents to know any other areas of the same shock. So he said, he himself gave the 3 incidents. When we go fast in cycle, when a sudden truck comes, we will say no, heart stops a second like that. ஒரு நிமிஷம் அந்த இதே துடிப்பு நிக்கும் பாத்தீங்களா அந்த மாதிரி. So one more thing, when I get a trophy for a game and suddenly while going home it fall and break, there will be fear. My parents will scold me. At that time also the heart stuck a minute and it comes. And then he said an incident while they are riding in a car, a Doberman, specifically Doberman chased them, and he got the fear whether it will come. That time also that stuck, heartbeat stops. I didn't probe anything. He gave a space, so I said, so what is the fear about in this everything? So he said, the truck may hit and injure us. Dog may bite me, that much stammering in his talk. Or see this, it will get hurt. Even if bite, if it comes our car may hit it that. So these 2 things coming, not only biting, it also will get hurt. So then that time all the parts stuck for a second. This is the action with the energy every time. So if dog bite also they will put 25 injection, then the injection place, the germs will attack. The same process he said, then all friends will laugh. If they didn't come to play, the same process of unconscious, this will become big. The same brain won't go, everything will function and coma state. That is the last end of this also. Next. So I asked, what is the stuck? I couldn't understand, so I asked, what is stuck in general? So he said, if a thief or someone did wrong, the police come to arrest. So he will have the fear they will shoot. So he explained very well. So I gave a book immediately. So do the process in that. He draw. While he is narrating, he is drawing the picture and story way of drawing. So before shooting, even in fear, police didn't shoot. Before shooting, in fear only a person becomes stuck. This is the example for stuck. No message and blood supply pass to the brain. 8 system in the body stops working. He says every system, digestive, respiratory, every system stops. He will fall. See there, shooting, falls unconscious. After 5 minutes, coma state, then they will get death. This is the thing. I rounded with the one system is get failing, then it falling down and it's coma and it's death. Next. So I probed into next area. Okay, this is complete. So we can take next area. So he said music, badminton, cricket, tennis, and take care of dogs. So I asked, what is the most favorite hobby? That's very important. In everything, if many things are coming, what is the most favorite? Then you ask whether it is good thing or bad thing in detail. Then in that which part is impacted, then go into it. Just slowly seep into it. Then only they will relive in that moment. So I asked, caring of dogs is his favorite, and it's like he have a team of members in the street, 8 members. Daily evening he buy biscuits, bring water for them and take care of the dogs. He will have whistle. After he is freshing up, he will whistle. Every friends from the home come out and take care of the dogs. So he created the team. That's about this team. I was surprised how I am maintaining for WhatsApp group also. If anything is injured or if anything is dog is missing, he will message. They will come take care of it. See. Next. So I asked because this is interest, what is the sensitive part? So I asked, what if the team is not there? He didn't go. That's why I probed. He said, I said that if there is dog somewhere or in your last street, how? No, I know. I will go rounds to every street and find any, if there is no one to take care, I will take care of them. So I said, okay, leave it. My street is on 3-4 streets distance. So I said, my street don't have the team like you. So if my dogs suffer without your team, without your help, how they will suffer? So he said, if there is no help, it becomes skinny, bone cracks, blood oozes, and death. This is the one way of death. If it is blind dog, the truck will hit him and it will die. If some puppy is trapped in a bush that is very thorny, it will then die. Then some other area dog come, it will fight, no? So that may kill the puppy. These are the things will happen to my street dog. This is the way we should project. So somewhere it will be easy. Bring fair, whatever possible, because it's, if we anchor it, be into it, surely it will move. So these are the things. Hurting, pricking, biting. See, I usually do visualize while checking or while speaking in my mind. That's why I put in the PPT. It's very easy to understand and we won't forget it. Only this thing come in my mind and I'll write also. So next. So I asked fear from childhood, dark, the ghost. So I asked ghost, what it will do? It will prick your eyes. It's very energy level. Prick in your eyes, beat, bite. The same thing, it will like a needle, like a thorn, blood comes, it stops, faint, the same faint, coma, death. So now I need to know the mayasam. So I asked, what is the reaction when you see the ghost? This time we have, in sensation level, we have to ask, what do you do at that time? So see, he said, when you cross a truck suddenly, how it will be like that. When the fear of bite, I panic and shout. With body gesture it came. Next, dream area. See, that is how the link is. So I asked dream. I got a dream of taking care of injured dog by giving food and I'm hugging. See the picture? This is the dream he got. So from after the day, he got the idea to take care of the street dogs. Immediately he formed the group in WhatsApp and with his friends. So with the dream, because of his sensitivity. So he is protecting that. So in this also, which affects injured and blood, the same thing. Next. So physical complaints, nausea, vomiting, headache in any exertion, thirst up is not good, involuntary not, the digestive system, there is the problem. Next. So as this is from his birth, this complaint is, I like to study about pregnancy history, how to take. That's why, because she is also my patient. So I know her remedy, she is Calcarea silicata. So I tried how to find the babies pregnant in him. So she said, when what affects you the most during pregnancy, which is not related to your soul. So she said, when I get pregnancy positive, I showed to a doctor, she suddenly said, no, it's negative. So it hurts me most and that impact is up to last. This happened 2 times. So after whenever checkup, she had the fear, whether she will score, whether she will be negative. That is how it feels for her, is feeling insulted and the impact, hurting, insulted, it's not her soul. Because I know the remedy, I differentiated this area alone. Next. So, what's the family? So, analysis. This way I do for every case till now. So, areas, school, fear, hobby, fear, dreams, that goes to, what is the everything? Only I mark, so many of them ask now, how you mark and how you pick the same. So, this is the thing I do in clinic also, for every case. So, just read the words scolding, beating, laughing, punching, pricking, injury, hit, attack, by vehicle, thought, bleed, injury. Next side, reaction, no message is passing, coma, unconscious, and he is protecting the dog's head. Only these things come by practice, and when you work out. Analysis, I take 1 hour to analyze only. So this comes. Next. So this is the human words of him. Laugh, truck hits, dog bite, germs hit. The sensation is the word, it will be injured, hurt, insult, shock, fear, to be touched. This whomever. In not only this case, in every case we can get this idea clearly. Then heart stops suddenly, panic, shout is the acute miasm. No message to brain. That what is that is the passive reaction of composite family. That is numbness is stupor state. That's why he is doing everything wrongly. That also come very clearly. Next. So subclass idea here, fear and flight situation. That's subclass 6. A sensitive plant kingdom, insult and injury sensitive, so composite, unconscious coma is the passive reaction. If it is active, the composite will hit back. This is passive reaction, so there is no hitting back. Acute miasm. Next. So repertory also. Not only sensation, you should confirm with repertory, metria medica, then you are 100%. You shouldn't forget the basics. That's also very important. So nausea is covering, headache is covering during exertion, rectum, involuntary stool, unnoticed stool, acrid, corrosive, voice, stammering also is covering. So fear of being injured. See the last generalities: faintness, fainting, injury from shock. Not even injury, the shock of the injury. Due to the injury, the shock itself, they get every reaction. That is what he said. Next. Metria medica, mechanical injury, especially stupor from concussion, the blood and the stupor state, result of shock, apoplexy, involuntary evacuation from bubbles and bladder. Everything suits. So you are 100% sure and it works. Next. So remedy. Okay, first month headache reduced, nausea, there is no complaint of nausea, vomiting after that. Involuntary stool reduced 30%. Next. So second month, no headache, the sense of urge to pass, he can feel now, okay, I have the urge to pass too, that he is able to sense sometimes, and the frequency also reduced 50%. In the fifth month, third follow-up is fifth month only, that time 85% it's reduced, and stammering is also reduced, that is the dilution of the state. Whenever he feels fear, the stammering comes, no? That is also, his mother said that, reduced. After that, the child said, I am very okay, why I need to need medicine? I needed medicine. So I said, why to take Rubram? Okay, leave. But when you have complaint, contact me. Then last month I contact him. Very rare. Only one time or two times in a month. Very rarely. Then I asked, did you sense or not? Yeah, I can feel. Then why you are not going? Why it's involuntary? So he said, if I ask to ma'am that I have to go to bathroom, I will laugh. So there is little bit of that sensitivity, so I gave 1 num. Then her mother said, after that 1 num till 1.5 months, there is no, even one time also there is no stool passing. Okay, DD of violence, family. So fear a dog will bite me and it pains. Case comes here. This can be talked by anyone because these families are common. So if fear is more, the dog is black, the teeth is sharp, when you bite it will be red. This will be solanaceae. Same sentence, but if fear is concentrated more, it's solanaceae. But here bite, that injury, bite me. If you go in the road, if there is blind, automatically it will hit injury, that is composite. Expected injury is composite. Then if it is unexpected, like I don't know, because I don't have the case to experience, but unexpected injury without knowing if it's something he feels that it is umbiliferal, and the pain, if constantly pain is like hell state. Even I have a case, crying of the baby is a painful hell state, and if they go into spiritual state like no need the pain, this world is full of pain. The pain, if there is concentrated more, it is paparaceae. So this is with one sentence where it is concentrated. That is the issue we have to pick up. By analysis you can, so this workout is very important. That's what I understand. Next. So case taking, artistic process of taking the patient. It's not cut, copy, paste. That's what. Learn from sir. Apply your, be art. You can be the artist in your own way. It takes the conscious level to subconscious level. You can understand the inner song of the individual and make them aware. That's what we needed. It can change the life of them and the family at large level. Next. So the tips for casing, this is not like what are the tips in book or something. What sir said and what I applied and what I experienced, that is the thing I am going to say. So first, observation. So before the patient comes to my clinic, I have at least 3 points about them, for sure points in my hand, like while giving appointment, while I give appointment. So what is the way of talk, pace of the talk, confident of whether dependent or dependent, for giving the date, whether they are asking husband, family, or they are confidently giving, whether they are so much anxious or they are waiting for me. A ringtone, someone, it's not only one time, persistently what we see in them. One patient called me at night 10 o'clock, 11 o'clock. I say I have a Konkan Gurukul, I can give after that only appointment, but he's so much restless and he needed the last Gurukul. So no, I'm so strict in that. No, after with every busy work, I need to be calm to take your guys after that. Then I found he is Ifar family. You have to finish that work. Otherwise, I feel tied up. So he needs an appointment. That end is needed for me now. Whatever, you have to give the date. Otherwise, he can't drive the bike or car, because that sitting the position itself, he feels tied up. While giving the case through Skype, he changed 5 places. Taking the phone, going back, because sitting in one place is for them is tied up. These are the observation we needed to be done. So WhatsApps I'll check. I will save their number and check the WhatsApp status. Actually, I don't like this FB. I am not active in that. But for patient alone, I go there. So on Ignition patient, they have always, she would put a song, message, broken hearted, disappointment, everything. So I have noted. Then while going the case, she said love relation, but it's going good. Where this disappointment comes? Usually we'll put love failure, disappointment. This is uncommon. So while going in the case, every place, friendship, family, father, everything is disappointment, initia. So it's uncommon when there is no love breakup and they are putting. That way we should take. Uncommon in what is common. So lithium case, she had, this is her WhatsApp status for 1 year. That is her mother, while birth itself she is not there with, but she edited and see, this is lithium, because mother, close to mother. She won't change. That photo only will be there. So this is, so little observation for confirmation, anything it will help us. Then a case of scrofulariaceae. It's a reference case. So my junior said she's so poor, she don't have she don't have smartphone, she have only button phone. So I asked whether she's educated. Yes. Whether she have work? Yes, she is in IT company. So if she is in IT company, she have work, no smartphone. This is uncommon. So these are the things I'll keep in mind. Then when the case taking, I found that she has some issue. So she don't like to connect with everyone. Detached, indifference. No any phone call from them, the people who. I no need to see their face. That's why she don't have smartphone. If smartphone comes, they have to see. They will call, they will say, why you don't respond. No need, detached. Yes. These are the confirmation and it helps us. Next. So I also encourage with relations, if they are known persons or friends, them also. So we can know any issue in the family, stressful incident faced by the patient, or any prominent character you see. I'll encourage them also, father, mother or friends. There also we get some point. This is a message came for me. It's like if we read that, it will be like a very standard English. But she is from a village, Tamil medium. But her English is so good, I feel difficult to read even. Standard words are used. So this is my refer from my sister. So I asked how she is in college. If she says English is so good, how she developed this? Yeah sister, it's very correct. We call her as dictionary. Even for marriage, we have made a cake named dictionary, because she's so much, she put more effort to learn that language and she's so much skilled in that. I haven't taken the case, so now this is for me dictionary girl. What made to do that? This is uncommon. She don't know the language, but he's so skilled, exact. What made to you do this? So these are the things before the patient comes to us, we can observe. Next. So importance of 15 minutes, sorry, it's not 10 minutes or 15 minutes, it's very important because what there is each behind us, surely it will cries out first time. It's not some other thing we will talk, which is close to us comes out first, it's for sure. So that we can get peculiar or something common thread or their area of interest so that we can anchor. How I said in observation we can keep an anchor in this way. But this 15 minutes we shouldn't be rigid, it should be casual talk. If you are rigid, the patient won't open the mouth, it will stop here. So it should be like a friendly talk. It develops smooth conversation. Again, next. So I like this very much. This is an FB video, a glass wall of China, and this. So the message, see, this is the comments. I like to read the comments of something different. So how they experience. So one of them written fearful and it's amazing experience. That is pain and pressure of paparazzi family. Anna said class seats, marvelous, awesome, spellbound in the bridges. That is of mineral talk. I do the challenge, I'll cross the bridge by keeping a running race. That is the animal quality. I'll competition. It's a worst nightmare. No, this is not for me. Sensitivity of plant. So in the comments we can get, I put this because what is the importance of the first half an hour, 15 minutes. With this we can all understand, no? We can pick up any area, we'll speak it. We have to see, that's our skill. Next. So take a break. This is very important. So I said, no, in this case how I take the break? Before we are probing and anchoring, you take some points, half an hour or 1 hour. Before we are going to probe, okay, deeper, just take a break. 10 minutes. Then what we do here, analyze and what we pick, what is the dimension. It will be smooth flow, it will be area of interest, surely patient will talk. So take a break. Till now I take a break. First 20 cases I took break, then I thought okay, now it's coming for me. Without break I done 10 cases, 6 cases is failure only. Then again I took re-case. So taking break, otherwise they talk and talk, we go somewhere. Till we need to take a break, we have to analyze, it will be very easy. At least after, like sir, it will be experienced. But initially taking a break is very important. And okay, so from this observation also we can anchor. Like this Arnica case, beating is coming as peripheral vision. So we should note everything, gesture, voice modulation, any other thing coming along with the laughing, beating. That's why, that is peripheral vision should be there. And projection denial, some cases will go as projection denial. Sir already said, we should project them, so they will speak. And in denial cases, no, I am not this. We should encourage, okay, it's okay, it's not that. Okay, but what is this? What's the fear about? So in a Lacassi's case, they said, I won't be cunning like others. So denial and projection is like two sides of the same coin. I won't, so I said, what is the others will do? What they will do? Then it went to cunning and everything, the animal quality, weak and strong, the process, about the neighborhood. So likewise, we have next. This is very important for us. What we do, we get 90% of, okay, it's enough, leave the 10%, this is the remedy we give. But what is the skill, what we don't have is the 10% should be seen. Pick that. Everything is horse, but that is not, no, don't leave it. This is okay, no, this much is there for us. Give the remedy, it won't work 100%. Up to cure, it will work, but not full cure will be there. So don't skip, it's very important. Be there to probe that only. It will open to a new path. So I had a case of cactus, now only cactus. First I thought it a calcarea card. Completely she talked about issues of stability, mineral, family, everything. But whenever there is some issues, she said that only there is gesture, my head. So I completely left that. No, everything is done. Everything is like about a row for issue. Then I took retake. I saw the video. What is this she doing? I completely forgot. Because we didn't probe after that. Then I asked, what is this? After this, while this is sensitive that and this cactaceae experience, sensitivity is coming after that only. In every area this is coming. So we leave some points. We should probe to the core. That is the important thing. Next. So the bit doesn't fit is very important. Only work on not that, not what is no. So doodle, that's very important. So when even though we didn't go to sensation level or whatever some picture, I asked to draw. After finishing the case also, okay, you said this, no, whatever picture you come, like for learning. So they draw. Sometimes when they picturize, I draw and see in my paper. The incident I draw. So see, scrophulary, I see one patient said that bonding and she is not clear, but the pod shouldn't be so tight and shouldn't be so loose. It should be correct. The tightness and looseness shouldn't be so tight bondage, it will break. Shouldn't be loose also, it will go. That is the scrophulary. So that they will explain with the picture. That's very useful. If we draw also, see, this is the togetherness. See, on the seeds are dispersed and the papaya seeds are fell like this, and everything has grown. And this is one. How this will be one? These are different 5 plants. No, every leaves touch each other, and there is separate also. We are one, like yesterday legumine. So fish also. If there is some fish there, some fish there, it's not. Family of fish means every fish should be near. Say schools of fish. So explain that. So we can see certain words, but when we picturize, we can understand the common thread. It will be easy. That's the technique what I follow. I am saying. Next, the doodle. So question to probe deep. So this is generally I am saying, if there is, they talk in name level, diabetes, thyroid or whatever, pain. So we should ask how to bring next level. What bothers you most? Tell more about it. Then they will go into the fact level, the details, modality, and everything will become. When the facts come, we should ask how it affects you. It takes to emotion level. When that emotion level, we have to ask how it feels like. Feels like takes them from emotion to, it's like a rough idea. Feels like it takes to delusion. In the delusion state, there will be some image. We should ask describe the image. Describe. So the image has this, that, the description. It takes it to sensation level. In sensation, we should just be there. Close your eyes. Then every details come. Like this. This is a rough idea of the questions. Next. So in analysis, the points I feel is every time I won't be satisfied if the case is okay. Arnica, it's everything came. No, we should have sensation. Take the repertory, because sensation came from sir collected from repertory, everything same sensation. Then he collected, then he understood, then sensation came. It's not something away from our basics. So repertory should match, material miracle should match. At least, not everything will cover, but at least 2-3 things should cover to make it sure. It's not like a this is only theory. It should be firm. So keynote maybe, sometimes genius of this remedy, pace, that also we can understand pace, talking pace, this pace should match the remedy. It's not like opposite. Remedies, they are very fast and very giving slow remedy, it won't work. So everything should be watched. If it's very remedy, I will check the Google. At least some points should match. It's acting there, the sphere of action in some or other way to know the action of the remedy or whatever. So analysis should not only be someone say if it didn't go in sensation level, no, I don't, beginners I have here. No confidence. What I will do? They probe, they leave, don't know. Whether it will come for me with sensation, what to give now? No, there are other things also. What we have learned, take it, they are not tools. Slowly this will come for you, but use other tools so that your confidence levels won't go down. So in aphorism 83, what he said, the individualizing examination of case of disease demands nothing but what? Freedom from prejudice. Don't be prejudiced. Be an open book. Sound senses. Be alert. Every senses should be alert. Observe. Attention in observing and fidelity in tracing the picture of the disease. So like be a log or something. Don't have any feeling, any emotion. Keep outside your clinic. Be unprejudiced. Flow with the river. Flow with the river. The patient. Only thing is keep your senses alert. Observe. When the peculiarity is popping up, just pick up. Then analyze. Then probe deep. surely the destination will be reached. That is simulum remedy. So no, don't be hurry, be patient, give the time, prepare the patient, prepare yourself, be calm, go with the process, be open book, be alert. Everything happens in its own with its time. Trust the process. Thank you.